Belize has averaged a suicide attempt every 5 days in the past 5 years, bringing the scary number to 382 over half a decade. In 2016 alone, there were 98 unsuccessful suicides. The local statistics also show that men die by suicide 4 times as often as female, even though there are 2 female attempts for every male attempt. In most of these cases, the individual is suffering from depression and or suicidal thoughts. A health forum by ministry officials to observe World Health Day today tackles just that, the chronic illness of depression.
The reason why depression was chosen this year is because of the data that's coming out. There's an estimated 350 million people living with depression. It is now a leading cause of disability because it's not only a mental situation, there's emotional situation, family structures and work structures that are affected because of depression. And also because between 2005 and 2015, in a span of 10 years, there was an 18% increase in the number of cases, making it one of the fastest growing affections globally.
In Belize alone, there are only 1,500 diagnosed persons living with depression. But even with those glaring statistics, the illness is underdiagnosed and undertreated because people are not seeking adequate medical assistance. The theme for this year is Let's Talk Depression. According to nurse Eleanor Bennett, it is a challenge to treat depression because it doesn't have a typical presentation to non-professionals.
It has many presentations. It's not just a person that the textbook presentation where you would imagine that somebody who is depressed is sitting in the corner crying all the time. It's not just that, but it's the person who goes to our clinic over and over for back pain and belly aches and stomach problems and can't sleep. Or it might be the person who is always a little too happy, as if they are trying to hide what they're actually feeling, that they're trying very hard for people to see that they're happy. Or it could be the person who says nothing, who is always quiet, who goes about doing their work, who just doesn't interact.
Depression doesn't have a face. It affects people of all ages and from all walks of life. While it should not be confused with sadness, depression can manifest itself as misplaced rage or lack of self-control in extreme emotional heightened states.
Depression doesn't have stages, but it has severities. For example, some people can be mildly depressed, and when somebody is mildly depressed, it means that they do have all the symptoms of depression. However, it is not affecting their lives. They can still go about their lives, but they're sad, but they might not be functioning as much or as well as they used to. And then it goes up to severe depression, where the person's function is affected significantly. So that person cannot perform well at work. That person might even be thinking about suicide. If you are not the talking type, then you will be the expressing or doing type. So, and if you're suffering from depression, which is a disease that causes some negative feelings, those feelings, if you're not taking care of them in the research way that works, they are going to come out elsewhere. And oftentimes it comes out as aggression. It comes out as withdrawal, and it comes out, and these things destroy your social relationships. So you're not as responsive to your children, you're not as responsive to your spouse.
The intention is to engage the public and listen in an effort to break the stigma against those who suffer from depression.
There are 3 approaches that work, and the first one is this: talking about it, getting people the right information, getting them aware of what it is, what to look for. And the one that works the most is to have people who have experienced depression talk about it.
As you will look at the team, it says let's talk, but I think the other side of that equation should be let's listen, because people out there might actually be seeing things that we are taking for granted, because we tend to stigmatize depression. Particularly in men, I think it's underdiagnosed. Men don't really like seeking, don't have health-seeking behaviors. They don't go to health facilities. because they're supposed to man up to the situation.
In Belize, there is a regionally recognized community mental health structure in place, including psychiatric nurse practitioners available at various community hospitals across the country. Duane, Moody for News 5.